Mochache, the chair of the board, Professor Oli Muganda, CEO, Dr. Njom, other official distinguished guests, management and staff of this distinguished institution. Thank you for asking me to say a few words. This is not a usual thing we do. We're usually working, seeing patients. But I think I first want to congratulate you for this facility, this excellent facade, which I think has been designed to try and achieve some of the goals that you have set out to achieve just by looking and seeing how things are working. So I must congratulate you on that. The second thing, of course, I'll focus my discussion, brief remarks on the area that I've been asked to cover, and that's on specialist services. But way before you get to specialist services, we have primary care. In fact, I often say that the primary care level begins in the house, in the home, with clean water, clean behavior, and so on. And that extends out. By the time you get to what we call the super specialist level, you'll have gone through many pathways. In fact, we should all be striving not to allow people to get to the specialist level of disease, if possible. That should really be what it is. And with the clarion call of patient-centered care that I see, an apt clarion call for this institution, I think that's a very good place to start. And I must also mention that much as we are striving to offer specialist services in this country, we must remember that the whole value chain is critical. The person wheeling the patient, as you saw just now, is very important. You're not going to be able to deliver that care until the support staff get that patient to you in a timely fashion. Otherwise, the patient will pass on. Conversely, you may be the drug may be fantastic, but if you don't have it, you're not going to get it to the patient. You may even have excellent clinicians, but if you have a procurement department that has provided you with the wrong medication or tools that are not working, you will not deliver that care. So that value chain across the whole spectrum is critical. So specialist care is only one cog in that wheel. We must remember that. And we have a role to play as specialists. We must recognize, respect every level of that care. And I think that probably is the most important thing that I'll say today. What I can then go on to say is that in the approach to deliver this care, what the specialists offer you is experience. Most of them have not left school yesterday. They will have been around for a while. They will have seen how things go. They will be able to advise on standards. They will be able to advise on what we call protocols. The word I like better is processes. They will give you endpoints of care. What are you trying to achieve? They will also guide you with training targets. Where is the need? There's no point of training 10 people in a particular area when you think that resource is better spent elsewhere. They will also guide you with clinical research. This is going to be a massive source of clinical data. And I would challenge the clinical director, who I've had a chat with, to take up that volume of patients and see that as a rich source and as a mine of knowledge, where we can begin to collect data on our population. We are very different, by the way, across the world. If you had any doubts, come and attend a few lessons in cardiology. You will see that we use certain drugs in certain regions of the world that seem to work better than in other regions. We must understand our population. So I think this will be a golden opportunity. So commitment with service, pride with service, and compassion. We must always be compassionate. If you're not compassionate with that patient, you will not give your best. You will not understand why you're helping this particular patient. They're not numbers. These are people. They have loved ones. They have a life. You must at first give hope, then start giving care. Care must be appropriate, must be delivered with empathy and with feeling. I think with those few words, I would wish this great institution success, and I have no doubts with the leadership of the chair here, who has an outstanding record. I have no doubt that this will be a great institution. I would just add, though, that it is not easy to reach where we're going. Many countries with a lot more money are straining to offer these services to their population. We're not going to be any different. So don't feel disappointed if you don't offer free service to every corner of this country at excellent level. All you can do is push the envelope a little further. Somebody also pushed a little further, as long as we keep pushing the same direction. Thank you very much.
Thank you very much, Dr. Kariuki. Madam PS, we want to develop a system where we are collaborating closely, not only with public institutions, but also with private hospitals, because at the end of the day, we are all taking care of Kenyans. At this point, I'd like to recognize Madam Benta Omonge, Director of Nursing Services at Nairobi Hospital. Thank you so much. And I'd also want to invite the CEO of Kikuyu Hospital to come and give us a few words on behalf of the private facilities. Thank
you. Chief guest, board member, CEO, all protocol reserved, good morning. I have been asked to give something I was not prepared, so I will be brief. It is a privilege for me to represent the private hospital. I hope we shall work together in case that need referral. And I'm happy to see that a public hospital that is delivering the universal health coverage, and we hope that we referral model will be efficient and effective to enable provision of quality patient care. Thank you very much.
Thank you. Thank you very much. Madam PS, a key component of healthcare is healthcare financing. And I'm sure you know it more than me, that financing is the key. And I can attest that the last 2 weeks we were in Mombasa trying to discuss the issue of healthcare financing, and it was not a ball in the park. NHIF plays a crucial role in trying to ensure that all our patients have access. And I'd like to invite the NHIF CEO, Dr. Kamunyo, somebody I've known from med school days, to come and give us a few words on how NHIF will work with us to improve healthcare in the country. Thank you, Dr. Kamunyo.
Thank you very much. Our Principal Secretary, Ministry of Health, Madam Susan Mochache, the Chairperson, the Board of Directors, Professor Olive Mugengi, Board of Directors, distinguished guests, colleagues, CEO and former colleague, Dr. Njom. Good morning. Was it good afternoon? Still morning. Good morning once again. It gives me great pleasure to be here today. And the reason is, in this state-of-the-art facility that is a public facility. Why it gives me great pleasure is because as we are on the last leg towards universal health coverage, our focus on ensuring that our public facilities have increased capacity to be able to deliver to our populace. Professor Mugengi, the door to NHIF claims was actually locked today. But I'll tell you, it's not that they've not been claiming. Actually, since we had our first contract with KU in February of this year, we have had 1,028 claims. So the patients that you're talking about that you have served, NHIF has actually reimbursed half of them. I'm not going to mention the amounts in case you've not done the accounts yet. But it is of utmost importance for NHIF as a national insurer to work closely with the public facilities, because that is the only way we will be able to achieve universal health coverage. And why do I say that? Because These would be the facilities that we'll be getting to and not having to pay out of pocket. We know that 1 million Kenyans every year are impoverished by out-of-pocket expenditure. And that's one thing that we are working towards eliminating. And as we work towards ensuring that even those specialized services, there's a lot of our resources that we send out, yet we can be able to manage here. So being in this specialized clinic is really, really important. And the commitment that we shall make, and with the constant assistance from Ministry of Health, is to position this facility as a facility to be able to offer these services to Kenyans across, and even maybe to our neighbors, so they can be able to access benefit. So ladies and gentlemen, I really thank you and congratulate the whole team that has been able to get this together. Thank you very much.
Thank you very much, Dr. Kamunyu. I was about to forget the other facilities which we have in our institution. I'd mentioned, being a clinician, I think I focused more on the clinical issues. But we also have plants within the facility. We have an oxygen plant which is able to not only supply our oxygen needs, but also to supply other facilities around. And we all know that with the current COVID pandemic, the oxygen requirements are very high within the country. So that's one area also we can support other facilities. We have incinerator services. We recently learned that a lot of our counties have challenges in disposing medical waste correctly. We have an incinerator which will be able to also to help other facilities. Dr. Kariuki, your challenge about research and development, we have taken it on board. We have a research directorate and innovation directorate which is actively engaged in pursuing clinical studies. And we are actually doing some studies currently on COVID. As I conclude, I wish to say that hospital management acknowledges the board of directors for the exceptional support and direction in setting up of the additional clinics and in the hiring of a great team of health service providers. My promise that the team will deliver premium services, which is what is expected of KUTRRH. So, ladies and gentlemen, it's now my pleasure to invite the chairperson of the board of directors, Professor Olive Mugenda, to address the gathering. Thank you very much.
Our chief guest, Madam Susan Mochache, members of the hospital board, the acting CEO, and members of management, invited guests, members of staff. Before I make my remarks, I would like to request one of the board members to just come and say something on behalf of the board. And this is something I'm just thinking now, so I'm sure they don't know who is going to come, but I'd like to ask Mr. KUTRRH to just come and say something, because he has been chairing a very important committee of finance. So, KK, I know I'm cutting off guard, but just come and say something to our guests and to the PS.
Madam Permanent Secretary, Madam Mochache, our chief guest today, Madam Chair, my fellow members of the board, staff, and also in a particular way the guests who have come and some of who have been represented here. This is obviously a very auspicious occasion for this hospital, and of course therefore for the country, because we talk as Kenyatta University Hospital, but actually we are talking about Kenya, because this is a facility developed by Kenya, by the government of Kenya. What I would like to say is that we very much appreciate, Madam PS, the support that we have received from your ministry in everything that we have trying to do around this place. I think I can say on behalf of my fellow members of the board, it is a fact that we have been very lucky that the vision carrier for this hospital has been the chair of the board. And I know that a lot of people have said how hard we work as a board. But I think we have worked hard because I know that also on our part, she has been working almost like a CEO, and that was inevitable. And I can even be honest enough and say, when we were given this task of starting this hospital, given my experiences in management and so forth, I did talk to her and I did talk to your former CS and said, we need this, unless the chair is going to have enough time to devote to this facility, we shall not get there. She has given us the energy. She has, of course, I'm sure you have interacted with her, and she has done more than we would have expected of her. She is always full of surprises for us, and pleasant ones for that matter. And I can only take this opportunity to say, let us all give, let's give a clap to Madam Mugenda. Madam PS, you are handling a ministry in a very difficult time. And we have seen all the things, now we know you are facing better because, you are forced to come to the public domain. But that is the struggle with the public servants in our country today. So please don't be disheartened by whatever happens. I'll just tell you, and Madam Chair and my fellow members of the board, we have to serve Kenyans, regardless of the politics. We just have to shut down our ear to the politics. Finally, because I'm here, on behalf of the other members of the board, and because you are always here with Madam Chair, let me say on behalf of the other members of the board, the staff of this hospital, we really appreciate the work you are doing. We know how far you are. We will just come for meetings. You are here every day. You work so hard. We see you running around all the time. You have been very courteous even to the members of the board. And so I would like to take this opportunity to say, for all of us, but you help us to clap for you. We want to clap for the members of the staff of this hospital. We really appreciate. Keep up the good work, and please, 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 please. You heard what the lady who was praying here said. Please keep God in front as you serve our people as Kenyans. Don't go on strike when there is COVID. Asante sana.
Thank you very much, KK, for encouraging us and for those kind words. I want to first welcome, once again, our chief guest, Madam Mochache, and all the invited guests who honored our invitation. When we are doing the list, we kept saying, are they going to be available? They are very busy people, but I'm happy to see that most of you that we invited are here. Thank you very, very much for that support. So we are marking another important milestone in this institution. And PS, we thank you for your support. Even to come here, I know you just come from Mombasa for other functions, but you promise that you'll be here and we are here. So we are thankful, PS, and we don't take it for granted. As KK has said, the hospital board appreciates the great support we have received from the ministry, both financially and just advice. As a new institution, we had a lot of questions, a lot of areas that were gray, but the ministry, through UPS, you are always there to give us guidance, given the experience as a PS in the ministry. So the opening of the specialist clinics is in line with the phased opening of services in this hospital. When we started, we knew that we could not do everything, so we started small. Of course, when we started, then COVID came, and we were kind of put in the deep end, PS, but I think we have been able to do our best. So, but even from the beginning, we knew that we would do it in a phased way. We were supposed to start, I think, with 160 beds, then go to 300 beds, and eventually get to the 650 beds that we have. So it is also in line with the universal health coverage mandate of the, of the government providing high quality and affordable health care to all Kenyans. So these are, as we have seen, multidisciplinary clinics that will deal with the most complex referral cases under one roof. And PS, we have been able to keep this hospital on referral kind of management. That is why you don't see a lot of walk-ins. When we started, we were not sure we would keep it that way, but I think we have managed to just deal with referral cases only. The cancer cases are quite high, so sometimes we are seeing some walk-ins, but we are working on it to make sure that also the cancers that are able to be handled at primary hospital level, they are handled there, so that we just get to deal with the complicated cases. But so far, I think we have done what we intended to do in terms of how the management of the hospital will be. So we hope to reduce the number of Kenyans seeking specialized treatment abroad once we are fully functional through the introduction of these clinics. The clinics that are being opened today will mainly handle non-communicable diseases, PS as we have seen, such as diabetes, hypertension, dental care, and other, communicable diseases such as HIV and all that. Almost a quarter of the world's population is estimated to have an underlying condition that increases their vulnerability to infectious diseases such as COVID. Most of these conditions that are underlying, Dr. John has told me they are called comorbidities. I always struggle with that word, but I hope I've said it right, Dr. John. Underlying conditions that, so we have been dealing with a lot of those. These clinics are demarcated into adult and pediatric suites for ease of access to the services. We have also started a process of building the first public children's hospital in Kenya, whose operations will start probably hopefully in the next 2 years. PS, the children's hospital, we started building when I was in KU as Vice Chancellor, and it was a project that was supported by none other but His Excellency the President. But then for some reason it didn't continue, so we are requesting you, PS, and I know I've talked to you a lot about this, that project is already started, the foundation was done, and if you go there, the columns are there, ready to go to the first floor slab. So we just need to complete it because it's like a stored project. This facility was a 300-bed children's hospital. So if we complete it, most likely it will be the first public children's hospital in the country, and that was our dream when we gave the proposal to the President about 5-6 years ago before I left KU. So I think, PS, if you can support us to complete that hospital, really to be a legacy, not just for you as a ministry, but for us as Kenyans. So we hope we'll be able to follow that one. The clinics have been scheduled to run from Monday to Friday between 8 a.m. and 5 p.m. and the clinics will have visiting consultants and also full-time consultants. And we are happy, PS, to say that we have been able to empanel very good consultants who may not be able to join us full-time because they are very few and very busy, but we have also been able to attract some full-time consultants to be with us in this hospital, and that is our model that we started from the beginning, that we have our own full-time doctors here to work full-time. The clinics also have a fully operational inquiry center, and we are integrating the online bookings into our HMIS system to increase efficiency and accessibility. PS, you remember also we were able to get one of the best HMIS system that is really very good in terms of integrating all the services, finance, outpatient, inpatient, the insurance services also. So it's one of the best in the country, and we are going to make sure that it's fully integrated so that we are more efficient. The services, as I said earlier, will be on referral basis only, where patients will have to be referred from primary care providers to here, but also will be available to inpatients, our own inpatient who may need further care as outpatients. There will be some also PS will be coming from our emergency unit and eventually, join our clinic. So that is the model that we want to use. So far, 357 patients have received treatment in the specialized clinics since they were set up. The busiest clinic is medical outpatient clinic which handles diabetes, hypertension, and also some other cases. Our chief guest, the specialized clinics, most of the patients who have been seen have been referred from Nairobi and Kiambu counties, but we also have attended patients from other counties like Siaya and others. And with the official opening, we know that these clinics will be very, very busy soon. This hospital will continue using the referral system so that the clinics are not overwhelmed by cases that could be treated, as I said earlier, by primary health care providers. The hospital board, and I would like to once again thank the board and CS, you gave me a very, very good board, very supportive. We call them all the time, especially to chair some of the appointments, and then they are always available. So, board members, thank you very much for your support. I don't think this work can be done by a board that is not united. Yes. So we work as a team, and they are very available. So the hospital board has taken very keen interest in hiring only the best for the specialized clinics. And PS, remember, you gave us permission to actually chair the appointments for all the staff, especially because we're starting. Normally, we would maybe chair for the very senior ones, but we took it upon ourselves with your permission to chair even the lower cadre, just so that we know that we have a critical mass of people that are good, and then eventually we will revert back to the higher levels only. But it has gone very well, and though this has been challenging due to the cost of such personnel that we have hired, we are glad that there are consultants who have taken up the offer. It's quite expensive, of course. PSs are very highly trained professionals, so we're trying our best to pay them well. And some have joined us, others are not able to join us, but we still continue to hire. But the enthusiasm and passion that these consultants have displayed gives the board confidence that will handle the most complex referral cases with expertise and dedication. And where that expertise is not available, we of course have the outside consultants who can come support us. And we have already a list of those consultants who have accepted to join us. One of them is actually here, Dr. Charles Kariuki, and I think we all know Dr. Kariuki as one of the, I hope Dr. Kariuki is probably the cardiologist interventionist doctor. We all know him, and for him to even accept to be part of the people we can call upon for complex cases, I think is an honor. Plus other doctors who have also accepted. We have a list of them, very, very senior doctors who will be supporting our consultants on the ground. So we have taken an approach that deviates from the norm, where the part-timers normally man our hospitals. As a board, yes, we are very keen that we are not going to have doctors who come here for 2 hours, they go to Nairobi Hospital for 2 hours, then they go to Aga Khan for another 2 hours. We want them here so that our patients can benefit. Of course, and that is why we also give room for external consultants who can come and support us, because they are few and they are all over in all the countries. But then our model is to have our doctors here as full-time, and I think we are achieving that, and we'll be sure that that is enforced at PS. Research shows that where a patient is able to identify with their doctor, the outcomes are better than where a patient is seen by a new doctor each time they seek treatment. And I'm sure the doctors who are here agree to that even us, when we become sick, we want to have confidence in the doctor we are seeing, and not have to explain ourselves to a new doctor every day. So this is where we are coming from. This is a practice in leading hospitals in the US and UK and even India, and it gives repeat patients the comfort of knowing that they will be attended by the same consultants as much as possible. In our benchmarking trips, we have gone to Mayo Clinic, we have gone to Johns Hopkins, we have gone to Yale and New York, and we have seen examples of centers of excellence where doctors are dedicated to the hospitals that that have employed them and with great outcomes. Yes, if I can give a personal experience just to emphasize this point. One time I went to the US and I had an accident where I actually fell and broke my ankle quite badly. And so I was taken to the hospital, and that was fixed. Of course, I came back in a wheelchair. And I remember I was the vice chancellor, and I continued with my duties for three months in a wheelchair, in crutches, the normal way, what happens when you break your leg. But I think they put a plate, is it a plate, Dr. Kariuki, whatever they put there to fix the bones. And they told me that I can actually live with that for the rest of my life. So when I came back, I thought about it, and after 4 years, I felt it needed to be removed. I just kind of felt I don't want to eventually die with a plate in my hand. So I started to go back to the same hospital. And yes, I found the same doctor who put the plate there 4 years later. So the same doctor who had put is the one who's removed. And that's what I'm saying, some consistency gives you comfort, and hopefully we can, we can have people telling such stories from this hospital if we can have consistency in terms of doctors. Yes, I think somebody was talking to you, but I was just saying that when I went back to have the plate removed, I found the same doctor who had put it in the first place, and I felt a lot of comfort that he knows how he put it, so he's the one who knows how to remove it. So apart from this being a new concept, and let me say this, PS, that our orthopedic clinic, really, I'm hoping that we are going to get such good doctors, because I can say, I think if it were not for the fact that I got a very good orthopedic surgeon to do my leg, I think I would be limping. It was very badly hurt. And the fact that I don't limp, I think that shows that yes, even here we can have good orthopedic surgeons who can help us have good outcomes. So apart from this being a new concept in public hospitals in terms of full-time doctors, we have a challenge with specialties that have very few consultants, and where this happens, of course, we will again get these consultants to come and support us when they have time and when they are available. Ladies and gentlemen, this hospital will continue to increase the services that we will render to the public and to ensure that they have very, very good services. And for me, I'm very committed. I think it's a vision that I've had for many years, and I'm sure staff members here have had this many times. That is something that it's a vision that I developed when I was studying in the US many years ago. And I knew that some of the best hospitals are university hospitals. And when I came back, and years later I had a chance to become the VC, I remembered that dream. And I was happy that I had a supportive government PS that listened and provided the resources to do the hospital. So I'm very passionate about it. I'm happy to lead the team here to make sure we have a world-class hospital. And before I end my remarks, again, for the sake of those who may not know, that we are starting the first imaging center, the molecular imaging center. We are very keen, PS, as we promised the President, to have the first patient in March or latest April. And we are in the process of getting the cyclotron here and the PET scan here. And we are going to have 2 of those PET scans so that we can have a lot of Kenyans benefit from the early diagnosis of cancer. So our cancer clinic is going to be very busy. It's already very busy in PS. It's going to be busy because we're going to have a lot of big Kenyans being diagnosed hopefully early enough so they can get treatment early. So that is going to be a game changer in cancer treatment. We are already working with governors so that now that we are going to have the cyclotron, which can now get the consumables to them, the isotopes, we are urging them to also buy the test cards, even if you get 5 in the country, maybe Mombasa, Western, so that again everybody doesn't come to Nairobi. So there's a project that is ongoing, and we have, PS, I want to assure you that we are on course. The building is almost ready. The team is going to Dubai, I think, to check one of the machines in 2 weeks. We are not able to go to US because of the virus. But we are going to make sure that the machine is checked by experts there, under the leadership of our ambassador there, just so that we don't delay the project. And then maybe when the virus subsides, maybe the team can go. So our guests, we want to once again thank you so much. And we will be calling upon some of the renowned doctors to form an advisory team. I think Dr. Karuki also talked about that. And Dr. Karuki, we have noted your advice of having the whole team, work together in terms of specialists, nurses, everybody, cleaners, porters, that ecosystem, we are going to make sure that is perfected. And so we'll do that. And the group of advisors, PS, who will be advising the board, this is something that was passed by the board some time back. We are going to actualize it, and I know doctors like Dr. Karuki, Dr. Mogera, and several other, Dr. Kerry of cancer, will get very good doctors so that they can be advising the board on the way forward, even as we go, because we need all the support that we can get in terms of making sure that this hospital stands out to be one of the best public hospitals in the region. So with those remarks, yes, I would want to stop there. Once again, thank you. I would like to welcome you please to come and open the specialized clinics. Thank you.
Thank you very much, Professor Mugenda. I wish to recognize the board, of course led by the chair, the staff, and any other invited guests. Good morning. I'm really delighted to be here today for this wonderful occasion when we are officially opening the Kenyatta University Teaching and Referral Hospital Specialized Clinics. As a ministry, we appreciate the additional specialized services offered by some of the best consultants that this country has been able to offer, because they contribute directly to the health pillar, the agenda, one of the big 4 agendas of His Excellency the President, the UHC. Let me also recognize that, Chair, you have said it very well, that this shall be a referral hospital. That is in line with the aspirations of UHC, where the different levels of facilities do what they are meant to do. And so we'll be watching very closely, and you'll have our support, that this indeed should not be a walk-in hospital, it should be purely on referral. And that is what we are also aspiring to the sister hospital, Kenyatta National Hospital. I want to thank you, Chair, and to thank the board as well, and to also thank the management of this hospital for all the efforts that have gone into putting together, an excellent team. And when we talk about an excellent team, I want to recognize the entire team that has been recruited in KU, from the support staff all the way up to the very specialized consultants. It's not an easy job to identify talent, and I'm sure the board you must have experienced how hard it is, even in the face of the large unemployment, to really get very fine people that are able. Indeed, what we have seen today is a testimony that we have attracted some of the best, and that is why today we can stand here and open yet again another phase of this hospital and embrace again, yet again, a key milestone for this hospital. So as a ministry, we are really looking for such dedication in the health sector and particularly in public facilities. This is our aspiration. We believe very strongly that public sector can also be the very best. It all comes down to us as individuals. And just like the wonderful lady prayed, if God goes ahead of us, and if we can all remember that the one thing we need to pursue, the greatest motivation and goal, if we can have it to be service, the rest follows. The challenge, of course, is sometimes we get misguided and put money ahead of everything else. We need to remember that service and excellence in service will distinguish us. And I have no doubt that now that this hospital has begun being laid upon the foundations of excellence, it shall indeed be an icon in this country and in the region on what public sector can do to serve its citizens. As I went round, I also noted that the clinics are all well equipped. With this, the human resource and the physical infrastructure, the ministry is very confident that this hospital will radically improve the quality of healthcare for referral patients now and in the future. Let me also say that the confirmation that this is perhaps one of the best facilities in the world was echoed by a team of doctors that came from the University of Manchester and the Christie Hospital, which are top leading global healthcare providers, saying that, in fact, this hospital far surpasses the Christie in Manchester, which I happened to visit, and I can confirm to you this is in a completely different league. So we know that with the infrastructure we have, then certainly we should be able to offer very high quality services. Ladies and gentlemen, I also wish to note with satisfaction that KU has continued to play a very key role in the management and treatment of the COVID-19 patients, while at the same time being able to increase the number of other health services to the public. This is indeed commendable, that though COVID-19 has consumed a lot of attention, not just at the health facilities, by the way, but even within government, we really also are aware that we should not continue to forget, or we should not forget that citizens continue to suffer from other diseases as well, and they still require access to the essential health services, which we really must make sure is not hindered or hampered because of the pandemic. And, I have walked the journey of KU dealing with COVID with Prof, because she's been calling me every time the hospital is facing challenges, resources, water view, very high expectations from government, from the ministry, that you must take in a high number of patients, and Kenyans loving the experience so much that we saw them on TV saying that they don't mind being sick of COVID and going to KU because they'll get to choose whether to eat chicken or fish and what have you. So I told Prof, yes, we shall pick the bill, but try and now not make it too comfortable for people to want to just stay in the hospital. So anyway, eventually I will guided and say, please focus more on your core mandate. Let us have the county, that is the NMS, also pulling its weight and carrying the load for COVID. And that position has not been vacated. We still hope that the hospital will not be overwhelmed by COVID, but rather continue to offer all the other services that are required. So the gradual shift in disease epidemiology from communicable to non-communicable diseases requires our collective attention to explore both curative and preventive modes of managing the disease burden that we have as a country. I refer to the diabetes, the lifestyle diseases, hypertension, cardiovascular diseases, which we normally call as laymen, high blood pressure, mental and neurological illnesses, cancer, amongst others. Without neglecting the communicable diseases, these are the areas where really we must concentrate our efforts in order to serve future generations in Kenya and beyond. And I think even as you offer services as KU, the statistics and the data on the interventions or the diseases that are more prevalent are the ones that are non-communicable. So the official opening of the University Hospital Specialized Clinic is as timely for us as a ministry as we seek to avail healthcare to everybody who needs it, both for communicable and non-communicable diseases. And KU is contributing to this mandate through the clinics that are being officially opened today, which include the medical outpatient clinics, that's the ones dealing with diabetes, we saw them, hypertension, endocrine, cardiological clinics, and looking at the specialized machines, the echocardiogram, the stress test, blood pressure, surgical outpatient clinics, where you're dealing with general surgery, neurosurgery, orthopedic and trauma, dental clinics to deal with oral health, oral surgery, bridges, crowns and dentures, ophthalmology clinics, also really being able to provide a much needed service, the cataract and intraocular lenses, implants, glaucoma and surgery, and finally a comprehensive care clinic for HIV and AIDS. I must say that the ministry will continue to develop and strengthen the healthcare system in our country in order to meet the needs of our population, of our people, and contribute to the sustainable development of our nation and the region. The government has achieved remarkable results in many counties through financial and human resource support to health facilities across the country. Particularly now with UHC, we have actually been able to support counties to put in about 7,900 additional healthcare workers, in addition to 2,000 health interns that have been located in various parts of this country. To me, and indeed to all of us, and here I also speak very confidently of my cabinet secretary, basic security is a crucial stepping stone in the process of national self-realization and growth. In the area of health, I'm convinced that where health interventions are planned and designed to achieve specific objectives within a number of development efforts, these interventions will continue to support and reinforce government socio-economic investments and lead to substantial benefits in the development process. Let me also just pause to say that I am personally delighted. Sometimes when we're in government, we talk about many things. Sometimes they still are suspended somewhere, but we talk about them. But today, I'm actually standing here dealing with a real issue, dealing with a real success, a real milestone for the government of Kenya and its people. So ladies and gentlemen, the specialized clinics will receive referral patients from the immediate neighborhood of Nairobi County, Kiambu, and because it is a referral hospital, actually it will offer services to all the counties in this country. I hope that the partners from the region that will refer such patients are present here today, and if they are not, we will continue to engage within the different platforms that we have to really have more people from the region get access to treatment in this country. Because as you know, health tourism is also another aspiration and another key dream for this country. And with this facility, you can actually see that We are not just talking, but we are actually walking the journey towards that realization. I also note that the clinics will also greatly contribute to the realization of UHC, as I said, which is a very top priority for His Excellency the President as a legacy that he would like to leave for the people in this nation. And this again is an evidence that the building blocks for UHC are actually very well sunk in our country, and we are well positioned to spring into greater achievements in the delivery of healthcare in this country. So as we move ahead in our efforts in the ministry, we want to assure all of you that the referral system does work and it is more efficient and effective in serving Kenyans. And therefore, patients really, unfortunately here, will have to be encouraged to adopt the good discipline of calling and making appointments and being able to be treated on that basis. I know people in the neighborhood would want to receive non-emergency primary care services at these clinics, and we want to just urge you to kindly and patiently let them know how the referral system works for harmonious coexistence. And in fact, on that note, one of the key interventions that have been made by His Excellency the President himself, him deciding that he's going to take a drive in informal settlements, going into Mukuru, going into Kangeni, going into different, I don't want to call them slums, but those neighborhoods that have got a huge population of people, and finding that actually there is no public facility that offers services. And because of that, he directed the ministry and the Nairobi Metropolitan to establish 19 health facilities in all those high population neighborhoods, having level 2 and level 3 health facilities. And by December, he will be launching the first set of about 5, and by March, all those facilities are going to be ready to serve the people of Nairobi. And so the aspiration of maintaining this as a referral hospital will really be addressed and supported by that intervention. Because part of why the citizens still come here is because what alternative they have. We have very few public health facilities in Nairobi. So that will go a long way to see us realize a very functional referral system. So KU specialized clinics will create a real impact as hospitals in most developing countries do. I believe that we will make impact if we collaborate with other hospitals. I think that's important. And today, I would have been so happy if we had had the CEO of Kenyatta National Hospital, the CEO of KUTRRH, the CEO of Malaria Teaching and Referral, the CEO of Spinal Injury, because charity begins at home. The collaboration needs to start within our own public institutions. Because I thought as I went around that for any of those CEOs of the institutions I've talked about, this would have been a great experience. There is no need to go and benchmark outside the country. This would have made a good benchmark visit for them to also start to dream and to have aspirations of how to lift those hospitals into the greatness of what this facility is. So we also hope that in this collaborative framework, we will take full advantage of telemedicine. We are working hard as a ministry to put in place a national ICT infrastructure for health. It's ambitious, but we will achieve it. If we build KU, if Professor Mugenda lived the dream of building such an outstanding hospital and stands here today to see it and to continue to offer oversight, we shall truly also realize the one healthcare system that will ensure that each of our citizens can access their health information in any health facility in this country. And obviously that will improve the outcomes of the treatment depending on where they go to in the country. Let me also say that we are well aware of the commitment that KU has made in advancing health, training, research, and innovation. And indeed, Chair, I was very happy when you told me that you're still working with the Manchester University and that you've even begun some research work around, well, I can't remember what you said, but you just told me that some work has begun. Or esophageal or something, cancer. Yes, I remember this talked about esophageal cancer. And again, when I visited the UK, because that's where the journey began, I was convinced, after I listened to them, visited the facility, that the only way we can help our country get to those levels is by partnering with such institutions and working together. So I'm so pleased that for me, I am also realizing something that we just did last year, visiting Manchester, and today, as I stand here, the collaboration has begun, and all that will bear fruits for the people of this country. So, finally, ladies and gentlemen, I want to, in a very special way, thank Professor Olive Mugenda. Prof, what you have done is something that a lot of people don't need to realize. I always say that if you can, one, be so sure that what you're doing is aligned to your life purpose, and if you can actually be able to realize milestones in the journey of the aspirations that you have come out with, I think you will have lived a full life. You know, and when your time comes, when our time comes, we can always sit and say, I lived, I did my bit, I contributed. And that's what God has been able to give you. You can say that you have done something. The journey for KU is not over, but I have no doubt that you, under your stewardship, you'll continue leading it to really fully realize the intentions when it all began. So I want to thank the board chairperson, Prof, as I have said, the CEO, the management, and the staff for all the commitment that you have put to deliver world-class health services to the public. As a Ministry of Health, I want to assure you, and as your peers, you have my utmost support as you forge this journey forward. Remembering always that our job is to put a smile on a patient. That's what my minister reminds us all the time. We are here to put a smile on a Kenyan's face. So all of us, in the different areas that we have been privileged to serve, because it's a privilege and an honor to serve, let us just try to put a smile on somebody, and the rest will just fall in grace. Having said that, ladies and gentlemen, it's now my pleasure to declare the specialist clinics officially open. Thank you very much.
Thank you so much, our PS, Madam Susan Mochache. It was a privilege to hear you and to listen to your advice. I want to call upon Professor Olive Mugenda to convey our thanks to the PS for coming, for speaking to us, and for availing even so many hours to be with us. Welcome to receive the gift, PS. The CEO, please. Let's clap, thank you so much. She has received the gift. She doesn't have to open it, but when you come to your office, I'm sure it's going to be a beautiful thing. Thank you so much. We are now going to have our board of guns. Mr. Omondi, please. Okay. Welcome, and please convey our thanks to everybody.
Our chief guest, Madam PS, Board of Directors of KUTRRH, our chairperson, our CEO, directors, deputy directors,
distinguished guests, ladies and gentlemen, thank you very much, Madam PS, for taking this opportunity to come to KUTRRH and open the specialized clinics. We are very delighted to have you here. This is a major milestone for KUTRRH family, and we are happy that you're part of that history today. Most of us work tireless nights to make sure this comes to fruition, and we are happy that you made that dedication to come to us. I would like to take this opportunity also to thank, a bunch of individuals that have made this mission become a reality. I would like to start by thanking His Excellency, the President of Republic of Kenya, His Excellency Uhuru Kenyatta, CS, Honorable Mochache, yourself, Madam PS, for supporting KUTRRH. We as management and staff of this hospital, we are delighted each time we have any challenges, anytime we have any vision that we want to achieve, that your ministry is usually ready to support us, and we thank you for that. I would also like to thank Professor Muganga. Prof, you as the chair of the board of directors, your vision is infectious. When I took this job, I didn't know I'll be challenged the way I have been challenged. And most of the staff here can attest to the same thing because you are hands-on. And I can say that we are happy to have such a leader who's hands-on and has stuck with the vision for such a long time, because most of us cannot do that. And it's a blessing to be part of your team. The CEO, thank you so much for your dedication for service, for your always commitment to make sure that the management, the staff are fully supported. You spend tireless nights here. Your car is probably the last one to leave here most of the nights, and we appreciate you very much. All our distinguished guests, our partners, I can quote one saying that I've always, helped with my progression in my career. If you want to walk alone, if you want to walk fast, walk alone. If you want to walk far, walk together. And for us as KUTRRH to walk far, we need you. Not just today, not just tomorrow, but for the entire journey. So my challenge to you, our partners, please don't leave us pending. Don't leave us hanging. We need you to make sure that we give the support to Kenyans, the support that they deserve here at home, as it has been attested through this congregation. What I would like to say is that our management have also been very supportive of this vision, and I thank you all for taking the time to be part of this today. And I can attest on behalf of them that we are ready for the task. Thank you very much, and we will not let Kenyans down. Thank you.
Thank you also for that vote of thanks. Most people who pass vote of thanks are not thanked. So thank you also. Yes, we have come to the tail end of our and we want to pray because you have a meal. We want to thank God for that meal. And when the time comes to go up, the lunch is upstairs. Our chief guests, the other guests will use the lift, unless anyone else wants to do some exercise. But everyone has to use the stairs on both sides. So you're all welcome for lunch, all welcome for lunch. So let us thank God and we will join for lunch. Dear Father, we prayed at the beginning that you be with us and you have seen you. May all that you have uttered be acceptable in thy sight. And may we remember to be of service, to have compassion over the patients and over all those we work with, dear Lord. Bind us with your love. We want to be one as we serve the people you'll be sending in this hospital. May we be a source of joy, a source of encouragement, and a source of healing for many. As we partake of lunch, we thank you for it. We know there are many who are struggling for something to eat. Some are even in this hospital who are sick and they can't eat. Others, my Father, have no food. But you've given us food, you've given us energy to eat it, Lord. We really appreciate your name. Guide us in your footsteps, Lord Jesus Christ, to serve others. And we pray this, dear Father, Supreme God, for thine is the kingdom, the power, and the glory forever and ever. Amen. Thank you and God bless you.